Schools, teachers, counselors, principals frequently have difficulty understanding the magnitude of pain, the severity of pain that occurs with CRPS. Oftentimes the limb that's involved looks relatively normal. It's a little swollen and discolored, of course, but it's not deformed. It's obviously not in a cast like an injured part of the body. There's no sutures or scars. And they have a difficult time comprehending just what the magnitude of pain really is and how impaired children are coping with that pain and what needs they have in the classroom. So it's very important to get a professional involved. Oftentimes in our practice that would be one of our psychologists or one of our pain medicine specialists, but it can also be a pediatrician or an orthopedic surgeon who can make a telephone call to the school and let them know what's going on and how severe the problem is. Of course, it's always possible to refer them to a website such as the RSDSA website or other websites, for example, the American Pain Society, so they can educate themselves about what this problem really is. Usually, though, that's not enough. Children with CRPS need accommodations when they are in school. Those accommodations might include considerations for mobility, carrying books between classes. They may need duplicate sets of books in each classroom so they don't have to carry those books. They may need extra time to transit from class to class. They may need breaks. They certainly need considerations when it comes to the completion of homework assignments and the time allowed for testing. They may need breaks to go to the nurse's office just to relax and to recompose themselves. And they need to be somewhat protected from the crowd around them so that nobody jostles them or injures or touches their affected limb. Now, how do you do that? Schools may offer you the opportunity to sit down and construct what's called a 504 plan. A 504 plan is a voluntary agreement on the part of the school to offer accommodations, and it's a negotiated agreement. And as the parent may sit down and say, we need A, B, and C, and D, the school may say, that's fine, we can offer you B and C, but not A and D. And you can negotiate with them an outcome, and oftentimes that's enough. However, if it's not enough and the accommodations are inadequate, children with CRPS are entitled to an individualized education plan. That's called an IEP. The IEP for CRPS would be filed under the category of other health problem, and it, you have to realize, is a facet of the Americans with Disability Act, the ADA. So there is a federal law which requires schools to provide whatever accommodations are necessary so that the child with CRPS can get the education to which they are legally entitled. Now, most schools will not tell you about an IEP. An IEP requires the school to make whatever accommodations are necessary. They will tell you about the 504 plan because that's a voluntary entity on their part and they can negotiate that. They cannot negotiate the IEP. So if a medical or a mental health professional tells the school that A, B, C, and D, and E are necessary accommodations for the child to succeed in school, that's what they have to provide, so it's more expensive. I'm sympathetic to the public school systems. I know they're strapped for cash, and I know they're strapped for personnel and space and other resources, but the most important thing is the need of the child. And as the parent, it's important to know about the existence of an IEP and to execute one when that's called for.